Occupational Therapy Month, and we're going to learn more about the program at Rhodes State College and exactly what it's all about. Joining me today, she is the coordinator of Occupational Therapy Assistance Program at Rhodes State, Crystal Hanuz. And thanks for coming today.
Thank you for having me, Holly.
Okay, so people hear occupational therapy, and I think you're helping them do a job. Not necessarily true, right?
Correct.
What is
yes,
it?
yes. That's usually everybody's first thought, but we do so much more than that. We get people back to doing their daily living skills. But daily living skills can be more than just bathing and toileting. It can be whatever you find value in your life. So, example, volunteering, taking your dog for a walk, teenagers, texting, video games, those kinds of things. So it can be just about anything. And we work with people who've either had a disease or a disability that has limited them being able to do their occupations. Or if that has taken away their occupations, maybe finding new occupations for them to be able to do.
You're kind of like helping with the mental health too.
Yeah,
I mean, it's physical, but also you're allowing them the independence they need.
Yes, and that's the thing that I really love about OT is that it's very holistic. We look at the entire patient, not just what is physically wrong with them, but what might be interfering mental health-wise. Great example if somebody has, a massive stroke. Okay, well, there's going to be some depression and anxiety that go along with that. Well, what do I do with myself now? So we take all of that into consideration when we're working with the patient.
And it can be all ages because, I mean, a car crash or whatever, it can cause some of these things that you might see, right? So you're not just talking the elderly.
No, we are not talking about the elderly. They are my favorites, but yes, we actually have OTs that work with neonatal babies, and then we work all the way up through geriatrics. So that's the other great thing. There's a wide variety of settings. From the nursing home, hospitals, schools, we kind of can go all over the place.
Wow.
So that makes it a good fit for anybody to kind of, find where your passion fits and work with those patients.
So how long is the program at Rhodes then?
The program is 2 years. We have a fall start, so we're going to be getting ready to start another cohort. So now is a great time to come in and find out about the program, get some of your prerequisites done and out of the way. We have had some discovery days that have been a great success. That is where we have majority high school students, but it could be anybody who wants to learn about the program. They come in and spend a couple hours in the lab with us and our students. So they get to see, what is the program, what's it like to be in here, and feedback we've gotten. They've really enjoyed talking to the students themselves, finding out, okay, how difficult is the program? What is it like? Getting all of those random questions answered from students instead of, just the instructors who, we're going to have a little biased view, obviously. But hearing it from the students has been really valuable to them.
Right, yeah. And, what's the career like in this program? Are people getting placed right away?
Yes, over the last couple of years, it's definitely had an increase. The majority of our students are finding jobs within 4 to 5 months of graduation. And that's probably even a little bit smaller because we have a national board exam we have to take. So they're studying for that right after graduation,
sure, yes.
Which we do have a overall 100% pass rate on our national board exam. So we, it's program's tough, but we do a really good job on it to make sure our students can pass that exam.
And it sounds like this is, of course, there's probably books and things you have to study, but a lot of hands-on stuff. You practice this.
Yes, it is a lot of hands-on. Our labs are very, very interactive, and even our lectures, we try to make them as engaging and fun. But, not everything can be fun.
Right,
sometimes there's some topics that are just, not quite, but we do have several semesters where there's field work, so you're going out and working with patients.
Nice.
And then that is actually the last semester. You're 100% out in the field working with those patients and getting all of that hands-on experience.
Wow, sounds like it's an awesome program.
It is a great program.
Yeah, all right. Well, thank you very much for coming today, Crystal.
Thank you.
Telling us about it.
Thank you.
All right, don't go away. Noon Edition continues in a moment.